when it comes to obviously patient care, people want to make sure that, they're being seen, they're being heard. I do want to talk about the ethics here. Do people expect a human to be behind these sorts of documents?
So I think you raise an interesting question, but again, I think it gets back to the point where it's not at the stage where a robot or a chatbot is just going to be doing this. You have a human in the loop. You have a doctor or administrative staffer who, even if they're just using this as a tool right now to speed up an administrative process, and the human still has final sign off. And I mean, what I would say in my own personal experience is, I know how overworked my doctors are, my primary care doctor. If she wants to use this to speed something up, and as long as she reads over the letter before she sends it, I would be okay with that. But again, I do think that is going to be a question going forward in terms of expectations and for patients. And I mean, with all of these things, I mean, consent is always big in healthcare. So as we start to see more of these technologies in use, there is going to be this element of patient awareness, patient consent. Even though I don't necessarily think that patients would have to consent to, something that's happening in the back office like this.
Katie, obviously, getting paperwork faster from the doctor's office sounds like best case scenario, dream come true. You said from a patient perspective, you would be okay with this, but I do want to hear about other responses. How are doctors, administrative staffers, and investors responding to this technology?
Sure. So I think there's a lot of trepidation among healthcare workers when it comes to technology in healthcare. And that has to do with this history of just really bad implementation. So over the past decade, there's been a big push to have electronic medical records that's digitizing your medical history and all of that. That was supposed to make things better and faster for everyone. And what ended up happening is different hospitals use different electronic health records, so none of them can talk to each other. So if I get an MRI at one hospital and then I want it to be sent to my doctor, oftentimes I'm using a CD to be able to get those images from office to office. And so I think it's experiences like that create hesitation, create skepticism. At the same time, the skepticism is healthy when it comes to implementing new technologies, but I do think that is a hurdle. That being said, we spoke to a really interesting company called Infinitus Systems, and this is a San Francisco-based startup. And what they have done is created a bot that, on behalf of doctors, makes phone calls to insurance companies to verify a person's benefits. And so again, this is speeding up what is a time-consuming administrative process. But the CEO of that company, Ankit Jain, he's very optimistic. He sees a future where you would basically, it wouldn't exactly be robots talking to robots, because this would be happening over an API. But the idea is that you would have almost instantaneous approvals or denials, because this could be happening using technology. Do I think, something like that, it's going to take a long time for widespread adoption? Absolutely. And it goes back to what we were talking about earlier, which is there's going to be concerns with these models around how they're updated. There's going to be concerns around their truthfulness, their accuracy. Those are the issues that we've seen, but what it's going to take is it's going to take those first movers. It's going to take a couple of hospitals, big health systems who say, I'm tired of how long this admin is taking and I want it to get better. And that's what investors are putting money towards. That's what new startup founders are creating. And like everything in healthcare, it moves slowly. This isn't going to be a change that we're going to see overnight. But I think I think there's appetite right now. It may be kind of slow moving, but to apply these technologies where it's appropriate and where it can help kind of bring healthcare into the next century, since it's still stuck in sometime with the fax machines, it's stuck in the 60s.
With the fax machines, the CD-ROMs, definitely still stuck in the 60s. And I know you're saying that we're still in the beginning stages. Things within the healthcare industry do move slowly, but do you think this has the potential to really radically change the healthcare industry as a whole?
So it depends on if we're talking about something like ChatGPT, or if we're talking more broadly about the possibility for generative AI and large language models. I think, again, like patient-facing care is where things are going to move the slowest. Where I do see a lot of investment and this generative AI technology being applied, it's probably going to be for things like drug discovery. It's being used for diagnostics. So say to help identify issues on x-rays or something like that. And these are all in varying stages. I mean, if you're asking me, is this going to revolutionize healthcare tomorrow or even in the next couple of years? So I would say no, because doctors and hospitals are still using fax machines, and that technology is 60 years old.
Can ChatGPT ever use a fax machine?
So, at present, I would say no. I don't know what's coming down the pipeline or possible. But so to go back to what Doximity is building, they have identified this problem. And so they're integrating their DocsGPT tool into their online fax tool, because they've realized that these faxes are still happening. So they said, okay, instead of an actual physical fax machine, we're going to do online faxing. And now they're integrating this ability to write, you write the letter and then you're able to send it in an online fax. So right now I feel like that's the closest thing.